Hello, this is Dr. Farley, and today I'm going to be going over with you some information about rheumatoid arthritis, explaining some of the mechanisms of action, how bad the problem is, what we're doing as far as drugs are concerned for this idea, and how we may be able to help someone if they qualify for our neurobiomedicine approach that we use. So the first thing to understand with rheumatoid arthritis is this is an autoimmune condition. That basically means that your body has antibodies. This is an antibody. These are made mainly for outside pathogens. Pathogens are germs and bugs that are supposed to come inside of us. So if these are germs and bugs, then after a while, your body would make an antibody for that germ or bug. And over a time frame, it allows your immune system to tag and identify the germ or bug. So the pathogens come in bacteria, viruses, spirochetes like Lyme, parasites, if I didn't say that. And over a time frame, this is a good thing that you make these antibodies. And there's three types of antibodies. There's the local antibody made on the what's called the secretory IgA. It's an IgA antibody. That's made mainly on the lining where there's these secretory IgAs. So you have four barrier systems. You have your gut, your lung, your skin, and your blood-brain barrier. So they all contain the secretory IgA, and over a time frame, those are kind of local antibodies. They do sometimes become systemic, but a majority of them, 95% of them, are local. And what happens is when a local bug comes in, a pathogen comes in, down in your gut, let's just say, or your lung, you make an antibody down there. So now that that pathogen is tagged, your immune system can get rid of it for you. So the purpose of tagging the pathogen with the antibody is so now your immune system can see it, and then it can get rid of the pathogen for you. The problem over a time frame is we're doing so many wrong things to our immune system, we get stuck into sustained inflammation. There's no such thing as chronic inflammation. The word is incorrect. Dr. Alex Vasquez, that I learned a tremendous amount of information from, basically says that we should change the word. There's no such thing as chronic inflammation. It's because chronic inflammation means you're going to find something to try to push down the inflammation. Sustained inflammation makes you switch your brain and think, what am I doing wrong? What could I change to stop the sustained inflammation? It's not just a problem that keeps going and going. You're doing something wrong that's pouring fire on the gasoline. And over a time frame, just a few things on some stats with rheumatoid arthritis. So some of the early warning signs is fatigue. People get extremely tired and lack energy. How many people in society are walking around with fatigue? A lot. If you have fatigue, it also means that you have damaged mitochondria. One of the main things that the mitochondria does is allow for your cell to make energy. So over a time frame, we're not making energy, and it also can be the beginning signs of the possibility of getting rheumatoid arthritis. Slight fever, inflammation, maybe. You might feel just generally unwell and feverish at times. And by the way, this can go on and off for years and years and years. Could be weight loss, stiffness, joint tenderness, joint pain, joint swelling, joint redness. So again, fatigue, slight fever, weight loss, stiffness, joint tenderness, joint pain, joint swelling, joint redness, joint warmth, numbness and tingling, decrease in range of motion, joints affected on both sides of the body. And those are some of the early signs. Then what we start to see is if someone takes an x-ray of you, we see major damage, different from osteoarthritis, from the inflammatory process taking place inside the joints. Many people, their hands start to become deformed. The pain can be terrible. They may also have accompanying gastrointestinal problems. They could have issues with sleep. They could have digestion issues. They may have major skin issues. Even signs of the brain breaking down, like memory issues, and I can't focus, mood imbalances, depression, anxiety. All of this can be connected to a sustained inflammatory response. Now, when you get this problem, it may take a long time for someone to finally diagnose you, because what's happening is we're waiting for more and more things to break down to put you into a box that clearly says, well, now you have rheumatoid arthritis. But if someone did some deep evaluation of you or your children, you might be able to know early on that, hey, I am at risk for getting this rheumatoid arthritis down the road. And all people that show signs of sustained inflammation are at risk for getting autoimmune, and one of the most common autoimmune is rheumatoid arthritis. So let's go back to the 3 approaches to this problem called rheumatoid arthritis. The allopathic drug model says we really don't know what's causing the problem. You're an autoimmune patient. You probably have a genetic glitch, and we're going to treat you with some drugs. And the drugs that we use are anti-inflammatories, steroids, and then we use these new things called biologics. I love these because the word is very misleading. So for instance, inside your body, if you're having a sustained inflammatory response, your immune system might release a chemical called TNF-alpha. This is what's called a cytokine. It creates inflammation all throughout the body and the brain over time. Now, when you create this TNF-alpha, this is not pathology. This is not abnormal. Your body requires some TNF-alpha. The real question is, why are you producing so much? Aha, imagine that idea. So over a time frame, we may use non-steroidal anti-inflammatories, corticosteroids, and then maybe they don't work, and now we start using some more of these biologics. And over a time frame, the concept of the biologic is that your body's producing too much TNF-alpha, and gradually what we're going to do is we're going to give you a TNF-alpha blocker that we call a biologic. It's really a drug, but we call it a biologic to give you a different marketing name so you don't understand that you're taking a drug. And what it does is it blocks TNF-alpha. Now the problem with that, or the good thing with that, is you may feel some improvement, and some people do. But the problem with that is the underlying fire still burns. We have not addressed the sustained inflammatory response, which means that you have other major risk of cancer, heart disease, stroke, chronic pain, other neurodegeneration, all kinds of other issues going on because you have a sustained inflammatory response going on inside your body and your brain. Number 2, you could start to show signs of allergy, metabolic inflammation. So you could also start to show signs of diabetes, thyroid issues, hypertension, metabolic syndrome. All those things could be connected to the same exact sustained inflammatory response, but no one's addressing it. And then lastly, we can start to show more and more signs of autoimmune. And the dangerous thing is this: if you've made one antibody against your joints, called rheumatoid arthritis, you might start making antibodies against your heart, against your brain, against your thyroid, against your skin, against your ovaries or your testicles. And gradually over a time frame, you have massive autoimmune attack eating you from the inside, destroying your entire brain and your body. So the idea that you only have, it's just rheumatoid arthritis is ridiculous. If you do not get a clear understanding of what's going on here, you can start to get multiple autoimmune tissues. And I've seen this in patients. So that's the allopathic drug model. What about if you say, hey, I don't want to do that. I want to use some of this alternative integrative model. Well, the thought process is basically the same. We know that it's autoimmune. It's probably genetic. And what we'll do is we'll do some things that are going to be a little bit safer than the drugs, and let's see if we can manage the symptoms. It's still pathology, disease focused. It's based on protocols, nothing specific with you. And diseases could be treated by alternative doctors, integrative doctors, complementary doctors, chiropractors, homeopaths, functional medicine doctors, naturopaths, and acupuncturists. Now, is the system a little bit safer because you're not using the dangerous drugs? Yes. Is the model the exact same? Yes. And then there's what I do, which is called the Farley neurobiomedicine model. The concept here is we're using the epigenetic science of dis-ease and longevity to try to figure out what's not working well. You'll see pictures of gears all over my website and if you come to the office. The gears depict that we're trying to restore normal function. We're trying to look at neurometabolic imbalances, and we're trying to figure out how many of these gears do you have off, At this point in time, we're up to about 47 of the most common problems we see in people that we call gears. And then we're trying to correct those issues. So the 3-step process that my patients go through. Number 1, let's do a complete thorough history, evaluation, looking at all your testing, and actually me listening to you. Not me just rushing you through and giving you a prescription and out the door you go. Number 2, doing a detailed examination and thorough diagnostic testing that I would run here at my office. Then making a decision whether your case would qualify or not. After your case qualifies, running more tests like very expanded and comprehensive blood work, very expanded specialty blood work or saliva testing, and then from there coming up with a clear root functional cause diagnosis. How many gears do we find wrong inside of you? We're not here to treat your disease. We're not treating any disease. We're going way deeper than that. We're looking at functional abnormalities and correcting the functional abnormalities so that your body, the power that made the body, has the potential to heal the body. What we also do is we then set up a clear plan specific to what your requirements are to restore function. Everything we do here is based on sound science and safety. There's no snake oil here in my office. You'll get done with an evaluation here and go, wow, that's the most thorough examination I've ever gotten done. When I sit down and go over blood work with you, no one has gone over blood work with you and done as much as I have in the number of patients, thousands of tests, and no one will sit down with you and take the time to go over your blood work with you. Just my expanded health profile and panel, that usually takes 2 to 3 visits of face-to-face communication for me to go over everything with you and make sure that you're clear on what it is. And then if we're running specialty panels with you, that could take another 5 or 6 visits. So we're not rushing you in, rushing you out. You're really getting excellent care, a very clear clinical picture of what's going on, and you're getting excellent, excellent, excellent customer service. So let's go over with you a few things that can create sustained inflammation. And a few things about sustained inflammation. It basically means that we're doing something to fire off that immune system over and over again, and we never give it a chance to calm down. So inflammation is normal, natural, and we need it. We require it to work and to live. If we didn't have an immune system that would create inflammation, we'd all die early. The problem is that we're taxing the system. We're doing things wrong, and no one is teaching us how the immune system works. So, by the way, sustained inflammation is usually involved in all chronic health dysfunction and disease. You heard that, all. 95% of all diseases are not genetic, they are epigenetic, and the number one epigenetic cause that I see in most of my patients is a sustained inflammatory response. So let's go through the 8 things that create a sustained inflammatory response. And again, I want to credit Dr. Vasquez for this because I learned a lot of information from him and various other sources to put together this information for you. The first is food and drink. Now, so you mean to tell me, Dr. Farley, that my food is creating my sustained inflammation? Yes. 85% of everyone's immune system is, guess where? In your gut. That's why your gut's sticking out like this. You feel gassy, bloated, constipated. You have indigestion. You have gastroesophageal reflux disease, irritable bowel, SIBO, ulcerative colitis, Crohn's disease, because the gastrointestinal system is off. And then after a while, guess what you do? You keep creating chronic immune dysfunction. God put 85% of the immune system in the gut because that's where the bad guys are going to come through. That's why it's there. So what comes through your gut? Your food and your drink. So I could say this to you. 95% of all diseases are epigenetic. They're not genetic. And the number one epigenetic problem that people are having that are creating 95% of those diseases is sustained inflammation. And the number one factor, creating sustained inflammation is improper food and drink. And let's be clear about this also. There is no such thing as the autoimmune diet because it's specific to you. If your immune system has made antibodies against avocado and broccoli and sea bass, you better remove those 3 things. But those 3 things will be in everyone's good diet because they're good foods, right? But they're not good for you. That's why we don't mess around with protocols and we don't mess around with generalizations. Our plans are specific to you, and that's one of the reasons why 90% of our patients that come to us see unbelievable great changes in 2 to 4 weeks. We expect changes, we can't guarantee results. Number 2 thing that's creating sustained inflammation: infections, dysbiosis, and leaky gut. Number 3, nutritional modulation and nutrient deficiency. This means that we have to change things in our foods and give the body certain nutrients that it requires to run the immune system. Number 4, dysmetabolism and dysfunctional organelles and mitochondria. Your mitochondria does many, many different things. It not only makes energy for your cell, but it actually is majorly involved in regulating your entire immune system. So if the mitochondria is breaking down, one of the side effects of that is we get stuck in sustained inflammation. Number 5, high stress levels. And stress is not only coming from your wife and your kids and your husband and your job. Stress can be coming in the form of chemical stress and physical stress in the form of, I fell down the stairs, I just had surgery, or I don't move. If you don't move your body every day, you create physical stress. Sleep deprivation, sleep goes off. A high HPA stress axis, social and psychological considerations all need to take place. If you talk to the same 3 people every single day, and those 3 people are highly negative, you're going to create a sustained inflammatory immune response over and over again. Number 6, endocrine imbalances. Blood sugar bouncing around, hypoglycemia, insulin resistance, and diabetes all create sustained inflammation. Imagine that. You eat something wrong that's too sweet, you whack out your blood sugar, and now you feel off and your joints hurt for the next 4 days because you don't understand what you're doing to yourself. Xenobiotics and immunotoxicity. This is the pesticides, herbicides, all the spray that we have going on out there, all the plastics, all of this stuff coming into us. By the way, we are bombarded. Our immune systems are overloaded with the stuff that they're giving us from our environment. We test all those things in the office here. Number 8, bioelectric dysfunction and smog. This is cell phones and Wi-Fi. Look up the booklet on your cell phone. It says specifically in there that it can create all kinds of health problems, and they're not responsible. So how much are we all being impacted by this? A lot. I carry it in my phone, in my pocket, I go sit in front of a computer, and it doesn't stop. So those are the main 8 top things that create sustained inflammation. And I just want to go over also with autoimmune again for a second here. Autoimmune, top tissues, thyroid is number 1. So if you happen to have a thyroid issue and rheumatoid arthritis, you already have multiple tissues. Number 2, blood sugar and diabetes. You can be walking around hypoglycemia, insulin resistance, or you're a full-blown diabetic, and it's not coming because you eat too many carbohydrates, it's coming because you have an autoimmune attack on your ability to regulate the blood sugar. Number 3, gastrointestinal autoimmunity. That can be irritable bowel, ulcerative colitis, GERD, Crohn's disease. All these things can be another potential autoimmune attack on the gastrointestinal system. Number 4, brain, spinal cord, and nerves. This can be multiple sclerosis. Yes, you're apt for all of these things if you don't get this sustained inflammation under control, because your immune system will make more mistakes. It'll tag more and more tissues. So brain, spinal cord, and nerve autoimmune conditions, multiple sclerosis, dementia, Lou Gehrig's disease, Alzheimer's, Parkinson's, OCD, bipolar, depression, anxiety, and addiction can all have a potential autoimmune component. So you're open for all of those if you have rheumatoid arthritis and you don't get at how do you modulate the immune system and how do you improve immune tolerance. Number 5, rheumatoid arthritis. This is one of the reasons why you're watching this video. Number 6, psoriasis. Number 7, lupus. And let me just explain a few things to you on autoimmune. There's 2 sides of the immune system, Th1, Th2. Like a seesaw, they should be in balance. If you go too high Th1 and low Th2, you can become autoimmune. If you go too high Th2 and low Th1, you can become autoimmune. Many more people are higher Th2 than Th1. You also want to know that if you're autoimmune and you've made antibodies against your own tissues, and you also have a high Th2 and a low Th1, you may also be at major risk of cancer. because that is the cancer profile. On your Th1 side are something called your natural killer T cells. This is part of the immune system that recognizes a cell that's turning bad and goes and gets rid of that precancer or cancer cell and gets rid of it for you. This is a normal process that our body goes through. So when we're manipulating the immune system with the biologics or the steroids or the anti-inflammatories, and we're not addressing the sustained inflammation, we are not correcting any of this. And our risk of us getting worse over time and our risk of getting all these other diseases goes through the roof. So I hope that you found this insightful. I hope that you see that what we're doing here is very unique to this problem. We normally can, if your case qualifies, we normally can start to work together and start to see some improvements relatively quick. Most of our patients in 2 to 4 weeks are recognizing some very positive changes. We constantly strive for optimal customer service, and we are always doing surveys with our patients to say, where are you, where are you? So that's how I can confidently look at you and tell you that if your case qualifies, 90% of the people that qualify see positive improvements in 2 to 4 weeks. Let me be clear again. We expect to get results for our patients, but we do not guarantee results. We don't treat any disease. We go deeper below the surface, and we're looking to figure out what's not functioning well. And then the magic can happen. The power that made the mind and body, made the brain and body, can heal the mind and body, can heal the brain and body. So hopefully you found this insightful. If you'd like to set up a free consultation to discuss this, you can reach out through either text, calling the office, or email. We'll set it up. We'll go through the consultation with you. We want to make sure that you and I are a personal fit, to make sure that we can work together. And if we think that things are moving forward, we'll discuss with you about moving on to a step 2 examination to ultimately decide whether or not your case would qualify or not. If your case doesn't qualify, sometimes I have opportunities to refer you somewhere else. And if your case does qualify, we try to give you the best options that we see fit to help correct your specific root functional causes. So thank you. God bless you and your family. I hope you found this informative.